The cone beam has been a monumental, life-changing, practice-changing investment in my practice. I would say the diagnostic capability of our office has increased 500%. That's a modest estimate. Being able to see three-dimensionally what's going on. Before the purchase of the cone beam, our diagnostic was two-dimensional. So you'd look on a traditional PA X-ray and you'd say, well, that might be a lesion, that might be an abscess, but you weren't really sure. And the patient's symptoms didn't really match with what was going on. You take a scan and the whole orofacial complex opens up to your view. So now that one tooth, you see every nook and cranny around that tooth. And what looked like a questionable lesion now becomes a full-blown abscess. We do quite a bit of TMJ work, and what we would use to diagnose TMJ problems would be transcranial film, which is just a two-dimensional image coming down through the skull, and again you had overlaying bones that were difficult to discern what exactly was where, and just didn't give a really great idea of the bony architecture. With the 3D scan, you can see that condyle and all of the bony deformations, all of the remodeling that's gone on, and there's just no question about what lesions exist in the TM joint. You can also see cervical abnormalities. We work with a lot of chiropractic physicians, osteopathic physicians, naturopaths, and they are able to see the actual relationship of C1, C2, we get all the way down to C5 or C6 in the patient's natural resting position. The cone beam has allowed my sleep apnea treatment to become more scientific. Up until this point, we've relied upon our pharyngometer, rhinometer, which measures the airway space. Again, two-dimensional. You see it on a flat computer screen. You don't see the airway or where these constrictions are occurring. You just have a modest estimate of where it's occurring. The pharyngometer coupled with the cone beam opens up an entirely new world, because you can actually see where the constriction is and see where you need to modify your sleep appliance if that's how the patient is going to be treated. I wish I would have invested in this technology at the beginning of my career. The number of cases that are accepted has skyrocketed. Since 2004, we have not had a more productive, busier year. It's not coincidence, in my opinion, that implementing this technology has allowed us to diagnose more, treat more, and bottom line, give the patient better treatment. When patients can see their head, their jaws, their airway, their sinuses, their teeth, they own their treatment. When they own their treatment, you don't have to be a salesman. Your case is sold just by having them see what's going on in their head.